Dr. Ibrahim Wada. I'm a gynecologist, trained at the APU in Zaria, Ahmadu Bello University, with experience working in Jos and also in Cambridge and Manchester in England. Apart from the gynecology aspect, many years ago I ventured into fertility and the making of test tube babies. So I'm one of the first experts in Nigeria to produce a test tube baby. The baby is called baby Hanatu, 17 now, very beautiful, and she's going to be a doctor. So that's it. Beyond that, I'm a family man. I also love golf. I'm one of the keen golf players here in Abuja, and that's the way a man I can fit. So, and the dream of establishing Nisa came to my mind when I was flying from Cairo about 1996. That's how many years ago? That's almost 19 years ago.
Yes.
I was on board a flight after meditation in the pyramids, and I realized that the logjam that I was experiencing then in public service could only be broken by venturing into part-time private practice. I came back to the country in 1994 because I wanted to establish a public center to help infertile patients who were struggling, and that was being frustrated for almost 18 months. So from 94 by 96, I just decided I must go and pray in the pyramids of the times of Moses, and I meditated a lot, I prayed a lot, and I saw this guidance, if you like, to start. So it didn't start just because I'm a businessman with a dream for a private hospital for Nigeria. It started as a reaction. Many people in my shoes at that time would go back to Europe, where I came from England, but I decided to stand and fight, and Nisa is that battleground. Nisa was started in May 1996, mainly as a fertility center, but we were lucky to have the first test tube baby in 1998. Don't forget, it takes 9 months to incubate. So, and that brought us to the fore in the national limelight. Since then, we decided to conquer all the factors that will help test tube baby making in Nigeria to be the same as England or US. And we are there by the grace of God. So as far as the fertility program is concerned in Nisa, I'm convinced that if you like, go to Atlanta and New York, if you like, go to London, go to Germany, the language is the same. So we brought Nigeria rapidly close to international standards, especially in that field. The next challenge was in vitro fertilization or fertility treatments in general lead often to twins and triplets. Yeah, and the babies were actually suffering because we didn't have neonatal practice here. Pediatrics practice was just coming up for children. So eventually, because of the frustration of the public sector in handling these babies, you've been waiting for 10 years, now you have twins, you have triplets, you depend on a public hospital. Before you know what's going on, there's no light, or somebody has not come on duty, and you lose after going through the stress of test tube baby. So we had to invest in a neonatology system here, which once again is done in partnership with some of my colleagues from Manchester. It is an international neonatal center, and one of the, in a very short while, we're going to have an international team on ground to look after premature babies, babies who are born with any kind of distress. Then the coming of national health insurance meant we needed to expand on what you call family medicine. So we have the gynae, the fertility, the neonatology, and now we have a strong pillar in family medicine, because it wouldn't be wise that you have a medical insurance and your wife comes to this hospital, you go to that hospital. So we have specialists in family medicine to look after the general health of the community. So that is Nisa for you.